And so, starting here, we begin on level 6 in the brain and nervous system room. So this first piece is the brain real thing, and here the meninges. It's the first time I've ever seen a piece dissected like this as a single unit. And it also mentions that the dura mater is sensitive to pain, whereas brain tissue isn't. And this is something that applies to a lot of different tissues around the body. When we talk about many internal organs, what we see is, when you're talking, for example, about the lungs, about the liver, is that the tissue itself is not susceptible to pain. The capsule that envelops it is. And that's why also sometimes when you have an inflammation, for example, you can feel pain at those organs, but that's mostly because it's inflaming the capsule around it or compressing it outwards. A clear example of this will be that people who have intraparenchymal strokes do not experience pain. They just, for example, lose movement on one half of the body. It is not like they have an intense pain like it would be for someone, for example, experiencing subarachnoid hemorrhage. That's different because blood irritates the meninges. That's exactly the point. The sensitivity to pain is on the meninges. Moving forwards, or rather caudally, we have a piece of corpus callosum connecting both hemispheres of the brain and the beloved brainstem piece. Now, if you've been to medical school, you've probably seen this piece a lot of times. And then, maybe it's not so beloved because of the huge amount of cranial nerve nuclei you had to memorize. But let's find something positive about it, shall we? Such as the fact it keeps you alive. As it mentions here in the text, the brainstem is responsible for coordinating the more basic functions of the human body. So, like when we think, for example, when we make sense of something, we are probably using the higher functions, especially the telencephalon. Now, when we talk about the brainstem, the midbrain, the pons, and the medulla, we are mostly talking about things like, for example, control of heart rate and blood pressure. It's the more primitive side of the brain. Finally, this last piece has been colored to show the regions of white matter and gray matter. And it mentions that the white matter is the region of the axons, the part of the neurons that pretty much conducts the electrical impulses, in contrast to the gray matter where the neuronal cell bodies are. Now, this is important because most of our most important neurons are myelinated. They have a myelin sheath around them, which massively increases the speed of propagation of the electrical stimuli. And most of the myelin is concentrated as a sheath around the axons. Myelin is white because of its high lipid content. The axons are white because they have lots of myelin. And that's exactly what allows them to transmit electrical impulses faster. So, when we get a demyelinating disease, an autoimmune disease that destroys, for example, the very cells responsible for myelinating the neurons, meaning the oligodendrocytes in the central nervous system or the Schwann cells in the peripheral nervous system, we tend to get pretty debilitating diseases because we just brought the conduction speed so much slower. It lost efficiency in transmitting neural signals. So that's how we get, for example, Guillain-Barré in the peripheral nervous system, where they attack the Schwann cells, or multiple sclerosis, for example, in the central nervous system, where they attack the oligodendrocytes. And of course, Guillain-Barré usually presents as ascending paralysis, whereas multiple sclerosis can present in many ways. But, for example, vision problems. Well, at first, these shouldn't be related to oligodendrocytes, because after all, the optic nerve should be part of the peripheral nervous system. Now the point here is it truly an optic nerve or is it really an optic tract? Because of all the cranial nerves, the optic and olfactory are the only ones that are actually enveloped by meninges. And since we've mentioned the central and peripheral nervous systems, why not take a look at this piece? Here we can see clearly that the brain and spinal cord constitute the central nervous system, the area enveloped by meninges, and for example myelinated by oligodendrocytes, and that from it spreads the peripheral nervous system. Now this distinction is important because pretty much the diseases that involve each one are quite different. Of note to us here, for example, that we haven't already seen in the brain models are the plexi. So here we have, for example, the cervical and brachial plexus, and here we have the sacrolumbar plexus. Their primary function is of course annoying medical students, but a secondary function is providing motor and sensory innervation to the limbs. And that's how you get, for example, Erb's palsy if you injure the brachial plexus during vaginal delivery with a shoulder dystocia. And to wrap up our discussion about both the central nervous system and the peripheral nervous system, and white matter versus gray matter, a cluster of neuronal cell bodies is called a nucleus in the central nervous system, but a ganglion in the peripheral nervous system. So something really interesting about this piece we haven't seen in the other one. Can you see? Deep inside the chest, the sympathetic thoracic chain, those are the sympathetic ganglia, and there are the preganglionic sympathetic neurons, usually synapse with the postganglionic sympathetic neurons. Sympathetic meaning, of course, part of the autonomous nervous system, the involuntary division of the peripheral nervous system that innervates smooth muscle, glands, and internal organs. It's also sometimes used as treatment for some diseases, such as, for example, hyperhidrosis, to do a sympathectomy, to just cut some nerves that are giving wrong stimuli, for example. It is also done sometimes for chronic pain, albeit as a last resort. This second station, meanwhile, is more concerned with blood supply and drainage in the brain. This first one shows the brain ventricles. The liquor or cerebrospinal fluid is produced by the ependymal cells lining the ventricles. It drains from the lateral ventricles into the third ventricle through the foramina of Monroe, and then from the third ventricle into the fourth ventricle through the cerebral aqueduct of Sylvius, and from there across the apertures of Luschka and Magendie into the subarachnoid space all around the brain, where it will finally drain via the arachnoid granulations into the durovenous sinuses, which all eventually converge into the internal jugular veins, closing the cycle. And here we have a quite different piece, which is actually the arterial supply of the brain. And while it's placed in such a way that we are looking downwards on it, the most important arteries for the blood supply of the brain are the ones at the base, kind of hidden from our view, in the polygon or circle of Willis. Here from the back we can see both vertebral arteries joining together into the basilar artery. From it will arise the posterior cerebral arteries, which roughly supply the posterior parts of the telencephalon or cerebrum. Meanwhile, in the front, in a very simplified version, the internal carotid arteries are branching off into the anterior cerebral arteries for the medial parts of the brain and the middle cerebral arteries for the lateral parts of the brain. And the circle of Willis, as most anastomosis, naturally occurring connections between blood vessels, is meant for redundancy, providing a backup pathway for blood to flow if an artery is ever occluded. Because if the blood supply is ever blocked for long enough to a region of the brain, you get an ischemic stroke. Naturally, as it mentions here, you could also have a hemorrhagic stroke when blood leaks into the parenchyma. Now, when I was in medical school, I found this to be a bit unintuitive, because why exactly would a hemorrhage prevent the brain from performing its normal functions? Of course, if it compresses it, for example, then of course, it can damage nearby areas. But why would a hemorrhagic stroke cause damage? And the truth is that blood is leaking into the brain parenchyma. The brain parenchyma is meant to have many things. It's meant to have cells, it's meant to have extracellular fluid, What the brain parenchyma is not meant to have between the cells is blood, so that naturally disrupts the natural communication between the cells. But going back to gross anatomy, here we have a nice sagittal cut of the head, and you can clearly see many of the labeled structures as well as some other ones. You can see the mouth and the food path, with the tongue occupying the vast majority of the space when relaxed, almost touching the palate, and then on here the epiglottis covering the entrance to the larynx, preventing food from entering the air pathway towards the trachea, guiding it instead posteriorly towards the esophagus, which is, in turn, anterior to the vertebrae, or in front of the vertebrae, and if we keep going even more posteriorly towards the back of the head, we will have the pons in front of the cerebellum, and upwards the midbrain, downwards the medulla, continuing into the spinal cord. And of course, it's hard to ignore the many sinuses, especially the frontal one and the sphenoid one, which are literally in our faces here. And turning to the side here, we have the brain of someone with Alzheimer's disease. Now, pretty much all elderly people will have some degree of brain atrophy. That's just how the brain works. It starts getting old. However, what we can see specifically here in this patient's brain with Alzheimer's is how severely atrophied it is. And something relevant for us here today is that, of course, Alzheimer's is a deadly disease, and you would expect this brain atrophy in someone to lead to some severe cognition problems. However, this is also why Alzheimer's patients are more susceptible to hemorrhages, to subdural hemorrhages. Because the brain cortex is so much smaller, the bridging veins that go from the cortex to the meninges get stretched. So any impact can more easily rupture them. And that's why we also see some other diseases more prevalent, for example, in patients with primary diseases such as Alzheimer's. So here there is a quite interesting and complete video about Alzheimer's that explains the full progression of the disease. And it mentions, for example, tau tangles, and says that it usually involves people older than 80, but can also involve those older than 65. And that's true, because 65 is usually the most common age for people who have a genetic predisposition to it, whereas 80 is more like the age at which anyone is susceptible to it. So let's now descend to the lower floor. And so, here it should be about the musculoskeletal system.